The following Agios-supported podcast is intended for informational and educational purposes only and is not intended as medical advice. Please speak to a healthcare professional before making any treatment decisions. The guests on today's show were paid to participate in this podcast.
Welcome back to Just Listen, Voices of PK Deficiency. I am today's guest host, Janie Davis, Director of Patient Advocacy at Agios Pharmaceuticals. And today I have with me
Tamara Schryver
and Alejandra Watson.
And today's topic is the life stage model. We had an amazing opportunity to work with a group of patients, caregivers, physicians from around the world on an Advocacy Advisory Council, the AAC for PKD. And an initiative that came out of that was the life stage model. So before we jump into that, I wanted to talk to you guys about the work that the AAC did and get your thoughts and perspective about working with that, with the Advocacy Advisory Council.
That was an initiative that we thought based in the unmet needs from the community. So we wanted to prioritize what was the most important parts of these unmet needs. So we were called some of the people to discuss these unmet needs and how can we accomplish and reach out to more people with this. So then we come up with a life phase model where we divide it in different I usually call them over the life of ages and stages, which is like an ASQ for children. But it was so important for us to divide it in different groups. In that way, we can understand better what ages or in the life of a person with pyruvate kinase deficiency will be facing throughout their lives. So we divided for young children, teenagers, young adults, and adults. And from there, we were trying to figure out what was the most important thing. So we came out with
symptoms and psychosocial symptoms
as
large
the largest
categories. Yeah. Mm-hmm. Yeah. And I was just going to add, just as a little bit of backstory, the AAC was basically doctors, patients, caregivers of people with PKD, and our goal for getting together was to be able to develop information to help people affected by PKD get diagnosed quicker and to get access to healthcare better. And we were going to come up with resources that were going to be handed out to people and doctors. The life phase model was really developed after we got feedback that while we were developing information, we had awareness that our community was pretty much being well served by hematologists, but there was still like this underlying unmet need of anxiety and stress and psychosocial problems. And so we wanted to figure out who's experiencing psychosocial stress. Is it different at different stages of life? How does that compare between the caregiver and the person who has PKD? Is it different at birth? Is it different as a teenager or your 20s and your 30s, 40s as an older person? So the more we talked, the more we realized this topic actually deserves a lot of attention. And that's when we decided to do this project.
Agios is a biopharmaceutical company that's fueled by connections with patient communities, healthcare professionals, partners, and each other. Building on these connections and the company's unmatched leadership in PK activation, Agios is pioneering therapies for rare blood disorders, including PK deficiency, thalassemia, and sickle cell disease. To learn more about PK deficiency, visit knowpkdeficiency.com. That's know as in KNOW, pkdeficiency.com. To join the conversation with other patient allies, follow us on Instagram at Ally Voices Rising. That's Ally, ALLY, Voices Rising.
And I know prior to that, the AAC had worked on a white paper and looking at the experience of those with PKD and how their communication was with their healthcare professional. And so coming off of the white paper and as you so eloquently said, Tamara, of identifying this life stage model. So how did the AAC go about? What was the process to get to the final model that has been developed?
So those of us in the AAC, we all related our own experiences. I mean, I remember we had a lot of in-depth conversations that were recorded by a third party. And thanks to our third party, they came up with a model that categorized, like Alejandra said, they categorized our conversations into two overarching categories, either physical symptoms or else psychosocial symptoms. Everything we said, they just categorized that. And then we provided feedback.
And we took it to our community. So the feedback from the community, after we put it all together, we talk about that we needed more experience for other people. So what we developed, it was a survey where we was taken to our community, and our community was able to take this survey, and we had a more broader idea of all of this in order for us to have a more proper way to let people understand what was the main symptoms, or when is more difficult psychosocial part. Because like it's not the same a baby than a teenager going through pyruvate kinase deficiency symptoms. And it's the same thing for a baby to get a treatment from PKD to an adult that is 60 years old, for example. So we needed to take into consideration all these ages. But even though when we are in the AAC and it was very diverse, we didn't have enough of all these ages. So the community was given their input for us to have a much better idea.
Yeah. So after like the interviews with the community, like you said, we had that refinement and stress tested it.
Mm-hmm. Yeah. So then I know there was a focus groups that were done sort of globally, and then there were additional interviews that further complemented what the AAC had brought together with the people living with PK deficiency, and then with the physicians who are treating those with PK deficiency. And there was a lot more data available in sort of literature around the physical portion. So the gap that you guys identified really was around the psychosocial issues and looking at the ages that were there. So when you think about that now and have had a chance to understand what the insights you got from the broader community, what are some of the things that stand out for you across the ages and stages within PKD from a psychosocial perspective?
Well, we take this large phase model to our conference, which gives us and gives the families a better perspective what they see it and how they see it. For example, it's not the same way that an adult patient will see himself versus what their partner will see. Because a patient will say, oh, I'm doing it right. I'm managing my PKD very well. And then you hear the wife saying, nope, That's not true. So we bring it to life, this base model, to compare in real time and real life with the families in round tables, what everybody's perspective. And that was so important also for parents with younger children, because they could see how it will be affecting their children's life in the future or not. It's not everything about that, but it's something that it kind of gives you and enlighten you as a person. So the life phase model, is specifically for the psychosocial, it was so important for us to develop and bring it to all the people and have this discussion.
Yeah, I agree. I think what we did was actually pretty brilliant. I think that it shows young families sort of a roadmap of what they can expect. And we had a lot of discussion. So we actually had a session about this at our conference. And so we tried to emphasize that everybody's path may be different. So that was the first thing. But the second thing was that this is something that your family may go through, and that's totally normal for a PKD family to go through these expected life events that we have tested with several other people and families in this community. So if you experience financial trouble, if you experience social isolation, if you experience bullying, these are unfortunately, I hate to say the word normal, but normal things that happen in the lifespan of a person with PKD. It doesn't mean that it's right, and that's why we're here. We're here to support you. But to sort of give them a peek under the tent for what they might expect. So I think that it was brilliant. I think it was interesting. We had people try to work out their lives against the life phase model. What we found, like Alejandra said, is that, couples might see their lives differently. Adult parents or parents of adult children, they tended to see their children's lives differently than their child. So they might catastrophize their child's life, whereas a child would be like, no, my life wasn't that bad. I learned a lot from having this disease, and it really wasn't that bad. But the adult would be more like, oh, it was so horrible. I don't know how they made it. And then at the same time, children that were still like 12, 13, 14, they tended to have the same view of their life story as their parents had of their life story. So those were some of the things that we saw at the conference when we did the life phase model with audience members that all had PKD. So I think it's a very useful tool. We have plans to continue to use this, and we'll use it going forward.
And also, just adding for what Tamara says, it's so important also to understand the big difference in between what is a patient with symptoms versus a non-symptomatic person with PKD. So it's a huge difference. But they were able to learn what are those differences in families and understand that maybe right now they would not have any symptoms, but that things could change and they will be prepared. So that was, like Tara says, this is a huge success, a great tool, because it gets you prepared for the future, prepared for what is coming. And it was a great experience for the adults part. They were in their 60s, to give us or enlighten us with their life, with their life experience, not just about, because of course they didn't have the same treatment. Like now we have so many treatments.
Right, that's very fair.
So the life experience is amazing, and how they did it and how grateful they are now. And basically what they are doing now It's like now we are trying to help more because they are helping us to understand because they didn't have this opportunity. And we are so grateful that they are putting their time, their effort, and all their knowledge.
So last year, last year at the American Society of Hematology conference, there was the poster that was shared on the life phase model, and that looked at both the physical and the psychosocial issues, and it looked at it at the ages and stages. So what are you guys' thoughts on educating physicians around PKD and them having what this life phase model is an opportunity to share with them the lived experience of those with PKD as well?
I think that it would be a valuable tool. And I would maybe make some adjustments, maybe have some examples, some examples in the tool. And I think that it would be very helpful for physicians that see patients. And so how could we adapt that to be a meaningful tool so that the physician can have a conversation with a patient? I think that would be a really great tool. And probably for physicians who are interested in their patients' total health well-being, it would be a great tool. I know some physicians only have 5 minutes with their patients, and it's going to be a really difficult to implement, that total approach. But for physicians that have more time with their patients, this will help set them up to know what kind of conversations to have with their patients. And I was kind of thinking about the applicability of this model for rare disease patients in general. I think other rare diseases could probably adapt this model and insert their symptoms. But I don't think this can necessarily be used for every rare disease. It is pretty specific to hemolytic anemias.
And I would like to add what Tamara says, that this can be a very useful tool for physicians because that can enlighten them and let them know that it's the psychosocial aspect that they can refer their patients to have a better mental health. Mental health is a myth still. We try to break those myths and make sure that our people understand that it's a mental health issue with PKD because all the things that they need to go through, because their bodies are different, because the brain is started to act differently just because of the lack of oxygen, because of the anemia, because of so many things. And that is where the doctors also need to focus. It's not just about the hemoglobin. It's not about just, I'm a hematologist and I'm going to focus in the red blood cells. No, it's a whole person that you need to focus, not just in the hemoglobin. And the psychological aspect in these patients are so important to have a more healthy society and more healthy lives. It's not just about the numbers.
Absolutely. And so when you guys think about, you made some reference to like, what would you like to do with this in the future? There is also the physical component that's a part of the life stage model. And I know there's a lot more data out there, but that's a relative statement. So there's still limited information for PK deficiency. And I know one of the common themes that come up is the idea that there's things that are happening physically. You mentioned earlier about sort of symptoms that even if you don't have symptoms, you still have PKD. So when you guys look at the model, how do you think about the physical portion of the model and looking at the different ages and things that are happening as children or becoming adults or older adults as well?
Well, I think that they tie in together. I don't really think that you can consider them separate.
Mm-hmm.
I mean, if the physical is poor, then obviously, to my mind, the psychosocial will be poor. Or you could say, I really think they're a circle. So you have to make sure that the physical piece is receiving optimal health. And I look at it as first you need a diagnosis, and then you need a good care provider and with a treatment plan, and then you need really good support. And that the treatment plan you could look at as treating the physical piece, but it also treats the psychosocial. And then the support, which is where I look at our nonprofits, we are helping on the psychosocial piece. So I feel like you get your diagnosis, you get your treatment and your physician for the physical, and then you get your psychosocial through that's like the complete deluxe meal. Yeah.
This is very complicated for me as a mother. What Tamara is looking, it's wonderful, and that's why we're working together, because she's a patient. She knows and she's very knowledgeable. In my side as a mother, I think that it's more into it, that we see has so many gaps. And Tamara and I, we always talk about the differences about how she has a perspective or something versus how I see it.
Right.
And one of the things that I probably will talk a little bit more in depth later is about fatigue. She feels like it's a normal situation that they put it's so common that it's so normal that they don't talk about it. Versus the people that we are looking at them and we are trying to help them, whether it's her husband or the mother or the father, whatever it is next to you, they see you struggling with your daily life. But they're so into this and they are trying to tough it up. They think it's like, oh, this is okay. This is not, I'm tired, but I'm lazy. Or I just don't have enough energy right now. But it's a real thing. And so we still need to explore more things beyond that, just a few symptoms that we already know from PKD. It's way more things. And we need to also educate these physicians, and not just the physicians, but the public in general. Because everybody will try to tell us, oh, no, this is not related to this. Oh, no, don't worry, this is not related. No, we need to get more information. We need to research more. We need to explore different avenues and stop to stigmatizing the people and say, oh, it's just because he's lazy. No, they are not. It's more into it.
Yeah. And I think to your point, you guys bring a very unique perspective as a mother of an adult son with PKD and as someone who's living with PKD. And then the perspective of when you're looking across the ages, what was evident is when you're looking at young children, they can't speak for themselves to what they're experiencing. So you, in essence, are talking to caregiver. And what we then saw as we looked at talking to community members who are young adults and then adults, and similarly, you start talking to their partners and their parents and the different perspectives. But I almost saw this as thinking about it as being a mother, like what to expect when you're expecting. And so that gives you an idea of what's to come.
That's exactly right.
And the aha moments for the community at the conference was, oh, I experienced that. And it does give, again, because so many times within PKD, folks haven't met someone else.
Right.
And so you don't necessarily always know what's the PKD and what's
just life.
Yeah. So that was that commonality and what the life stage model has brought together. So you mentioned it before. What do you guys want to do with this in the future?
I think there's a few ways we can go with it. I like the idea. I mean, I think just further adapting it to a handout that could be for the patient and also for the care provider. We've been holding off because we knew the merger was coming and that we're building a new website. We're having a new logo. So we have, like I said, been holding off, but we are going to do it. And it's not dead because it is such a brilliant piece. So it will be coming in 2025.
All right. Well, thank you guys again for being here, for Alejandra Watson and Tamara Schryver. And on behalf of the PKD community, thank you. Thank you for all your work, all your advocacy, and everything that you're doing. We're excited to see what 2025 and beyond holds for you.